Have you ever had one of those amazing, rich meals, like a big, juicy burger and fries, and then an hour later you're just doubled over in pain? Well, you are definitely not alone. Today, we are digging into gallstones. They're a super common problem that honestly, most of us don't really get. So let's pull back the curtain on this little medical mystery together.
So, let's set the scene. You've just polished off a fantastic dinner, maybe a big holiday meal or your favorite decadent dessert. And then, out of nowhere, the sharp, gripping pain starts building up right under your ribs. It's the kind of pain that can literally make it hard to breathe. It's intense and, yeah, it's pretty scary.
Well, that crazy, intense feeling, it has a medical name, of course, biliary colic, but it's way easier to just think of it as a gallbladder attack. It's basically your body sounding an alarm bell, telling you that a gallstone has created a major traffic jam right at the exit of your gallbladder.
So, what is actually happening inside you to cause all that drama? Well, after you eat, it's your gallbladder's job to squeeze out this digestive juice called bile. But if a stone is blocking the door, the gallbladder is squeezing with all its might against a solid rock. That immense, pointless pressure, that's what creates the agony of a gallbladder attack.
Okay, let's break down the signs of a classic attack because the details here really, really matter. First, it's a constant, deep ache, usually on your upper right side. But look at this next point, the duration. This is critical. The pain lasts for less than 6 hours. And here's the real kicker, the thing that tells your doctor so much. In a simple attack like this, your blood tests, your labs, will come back completely normal. That's a huge clue.
Now, for as intense as an attack can be, here's the wild part. Most gallstones never cause any trouble at all. I mean, the vast majority of people who have them are just walking around, completely unaware. So, who gets these sneaky silent stones and what puts you at risk? The numbers here are honestly kind of mind-blowing. Up to 1 in 5 adults in the US has gallstones right now. Think about that. If you're in a room with just 10 people, chances are good that 1 or 2 of them are walking around with gallstones and have absolutely no idea.
And this is maybe the single most important thing to know about gallstones. For most people, they cause 0 symptoms. None. They're totally silent. In fact, most of the time, doctors just happen to stumble upon them by accident when they're doing a CT scan or an ultrasound for something completely different.
So what are these things even made of? Well, the most common type, by far, are cholesterol stones. The easiest way to think about it is this. Your bile is like salt water, and it has to keep cholesterol, which is a fat, dissolved. But if that balance gets thrown off, too much fat and not enough of the dissolver, that cholesterol starts to harden into crystals. And those crystals clump together to form stones.
Now, to help remember who's most at risk, doctors have this handy little trick called the 6 Fs. As you can see, it's things like being female, over 40, or having a family history. And you might wonder, why female and fertile? Well, think about pregnancy. It's like the perfect storm. Hormones can make your bile richer in cholesterol, and at the same time, they slow down your gallbladder, giving those stones the perfect chance to form.
Then you've got the other, less common kind, black pigment stones. These aren't about cholesterol. Instead, they're made from a buildup of something called bilirubin, which is a waste product from old red blood cells. So you tend to see these stones in people with conditions where a lot of red blood cells are breaking down, like sickle cell disease or even serious liver disease. Okay, so we know what they are and who gets them, but how do you actually find these things when they're hiding inside you? It turns out there's one test that is the undisputed, hands-down gold standard for playing detective.
So, what's the secret weapon doctors use to spot gallstones? You might think it's some super fancy, expensive scan, but actually, it's something incredibly common, totally safe, and unbelievably good at its job.
And that test is a simple abdominal ultrasound. Just look at that number. It's over 95% accurate. What that means is it's amazing at finding stones if they're there, and it's just as good at telling you with confidence if they're not. It is without a doubt the undisputed champion for finding gallstones. So, when the radiologist is looking at the screen, what do they see? Well, they're looking for a few classic signs. First, the stones themselves show up as these bright white spots. Second, and this is the dead giveaway, the stones cast a dark acoustic shadow behind them because the sound waves just can't pass through. And finally, if they ask you to roll onto your side, they're looking for the rolling stone sign. If those bright spots tumble around, that confirms they're just loose stones inside the gallbladder. This right here really shows you why ultrasound is king. It's not just that it uses totally safe sound waves, unlike the radiation you get from a CT scan.
It's also just way better at this specific job. I mean, look at this. A CT scan or an X-ray can miss more than 80% of gallstones. That's because most of them are made of cholesterol, which is basically invisible to those scans. So if your doctor suspects gallstones, an ultrasound isn't just the best first test, it's often the only test you need.
All right, the ultrasound confirms it. You've got gallstones. So now what? It's easy to think surgery is the next logical step, but the decision is actually way more straightforward, and it all comes down to one simple thing. This is the big question on everyone's mind after they get the news, right? Does this mean my gallbladder has to come out? Well, when it comes to treatment, there's one key question that changes absolutely everything. And that one simple factor is pain. It's as simple as that. If your gallstones aren't causing you any symptoms, no pain, no attacks, the approach is called expectant management. And you know what that means? You do absolutely nothing. You just watch and wait. But if you have had that painful biliary colic we talked about, then the definitive solution to stop it from happening again is surgery to remove the gallbladder. Now, a really quick but super important note on pregnancy. Getting diagnosed is the same, and ultrasound is perfectly safe. For pain relief, doctors will usually avoid things like ibuprofen. But here is the most important takeaway. If a serious complication happens and surgery is needed, it is considered safe for both mom and baby and should absolutely not be delayed, no matter what trimester it is. That's a really vital piece of modern medical knowledge. So we've talked a lot about that classic gallbladder attack that lasts for a few hours and then goes away. But what happens when a stone causes a problem that doesn't go away? This is where we need to talk about the red flags, the warning signs that you absolutely cannot ignore, that tell you a gallstone problem has just become a real emergency. So take a look at this. The first one, acute cholecystitis, is just a fancy way of saying your gallbladder is now infected and inflamed. The key sign? That same pain, but it lasts for more than 6 hours, and you get a fever. Next up, cholecystolithiasis. This means a stone has actually escaped the gallbladder and is now blocking the main bile highway for the whole liver. This causes a backup, leading to jaundice. That's when your skin and eyes start to turn yellow. And finally, the most serious one, acute cholangitis. That blocked duct is now badly infected. This gives you what's known as the classic trio: fever, jaundice, and severe abdominal pain. And this quote right here really sums it all up. If you remember one thing, make it this. With a simple gallbladder attack, your lab test should be totally normal. The moment anything on that blood test is elevated or looks off, that's a huge sign that you're dealing with a complication. It's the fastest way for a doctor in the ER to know if this is a simple problem or something way more serious. And that really brings us to the big question for anyone who finds out they have gallstones. Are they just these harmless, silent stones that will never bother you? Or are they a ticking clock, just waiting for the right moment to cause a serious problem? When it comes to gallstones, knowledge really is power. Understanding the difference between a simple attack and the warning signs of a real emergency is what allows you to be in control of your own health. So I hope this helped clear things up. Thank you so much for watching.